most people think I'm a little young, but I'm way older. So in my practice that spans over 20 years, I've seen lots of things that you may describe as, I think horrific is on the other end, but yeah, they're really
disturbing.
Really, exactly.
Yeah. I'm Victoria Sabia, and today we're delving into one of the most important yet often overlooked conversations in women's health: postpartum care.
It's one of the most feared complications of after giving birth or preparing. And it's the biggest cause of maternal mortality worldwide, let alone Uganda. Of course, in Uganda, it contributes up to about 42% of maternal deaths, just behind other things like infections, including malaria and so on. Bleeding per se is something that has to be focused on if we are to reduce maternal mortality.
Now, every day, thousands of women across Uganda give birth, but for many, what happens after delivery isn't given the attention it deserves. From excessive bleeding to infection risks, hygiene challenges, and emotional strain, postpartum recovery can be a complex and fragile phase. Now, joining me today is Dr. Nyombi, an experienced obstetrician and gynecologist at Rosewell Women and Children's Hospital in Kampala. He's worked with countless mothers through pregnancy, delivery, and recovery, and he's seen firsthand the gaps in how we support women after childbirth. Later in the show, I'll be joined by a representative from More Distributors, a company dedicated to improving postpartum care through quality, affordable hygiene and recovery products. But first, let's begin with understanding the real issues on the ground. Dr. Nyombi, thank you so much for joining us today.
Welcome.
Let's start the conversation and really talk about what postpartum care looks like in Uganda. I'm wondering, when women delivers, what typically happens afterwards?
Well, you must have knowledge about what postpartum care is. Just for the purpose of this conversation, it is the period when somebody has completed giving birth. That's the last part of delivery. That's delivery in the placenta, and it stretches up to 6 weeks. That's the period that we call postpartum care. Then, if you want to get detailed, you can break it down into immediate postpartum care and then the late postpartum care. The practice in Uganda, you'll find that it really varies quite much, as we have a standard guideline by the Ministry of Health. But in terms of practice, it will vary between both private practice and then what other people do in government practice. And it's not because of lack of knowledge, but it's because of other factors that may affect the people that visit both the private and the public institutions. However, the general rule is the same. Once somebody has given birth, they're at a very big risk of complications of giving birth. And that is mainly bleeding, infection. There are other things like preeclampsia or hypertensive disorders. And those are very key to watch out for, both in the immediate period and then the later period. So when you ask me what it looks like in the country, I would say that there has to be extensive monitoring apparatuses, both in human resource and equipment, for the mother and the baby. We tend to forget the baby, plus the baby, to be able to pick complications or to anticipate them in case they're going to happen, and then attend to them. And then usually when you discharge the patient, the practice in Uganda or the guideline in Uganda is somebody who has given birth normally without complications should go home within at least after 24 hours. So, or they should stay in the hospital for 24 hours before they leave to go home. And then somebody who has had a C-section, a cesarean delivery, should stay in the hospital for at least 3 days before they go home. So when somebody is deemed fit to be discharged, they are expected to be reviewed after 6 or 7 days. So when I discharge you, we should come back for review. And we are looking at that period because we know that majority of the complications are going to happen there. So on your review, we call it, it's called the 6 rule. So the intensity of review, examination, or follow-up should happen 6 hours, and then 6 weeks, 6 days, and then 6 weeks. So after you're discharged and you're reviewed after 6 days or 7 days, and everything is okay, of course, there's a lot of counseling there about breastfeeding, wound care, both if it's an episiotomy or a cesarean wound, and then generally examine you for possible complications like hypertension or preeclampsia, and then check out for other things like infections that may happen on the wound of a cesarean section, or on the wound if you had an episiotomy, or even in the birth canal, for example, the vagina. When the baby comes out, there's a bit of tissue damage or inflammation, so that puts a mother at risk of infection that can extend into the uterus and the other parts of the body. So those are things that we look out for at 6 weeks. And then after that, we expect to see you after 6. Okay, we said 6 days. The other one is 6 weeks. After 6 weeks. So 6 weeks, we are intending to close off your review in terms of that pregnancy. Yeah, as far as that pregnancy is concerned, everything that we need to address must stop there. The other consultations can be done on demand. But at 6 weeks, we discuss, we know that now the body has gone back to the non-pregnant state. Your body should be functioning well. We may now discuss family planning at that time, okay, and then maybe give you a bit of advice on how to take care of the baby. You know that at that time a mother is planning to wean, yeah, breastfeeding versus supplementary feeding. So all that information is given to you at that time. However, I would say that there's a very big challenge in the public institutions. Majority of the time when someone gives birth, either because of human resource, majority of the time it's human resource. Someone will go, oh, are you okay? Is everything okay? The reviews that are meant to be done more often may not be done because there's not enough human resource compared to the number of patients that may be in that institution. And that leaves a loophole for complications. And then even when mothers are asked to come back after 6 days, they barely do. Reason, they are probably coming from very far, or even when they are not coming from very far, they may not have the transport to come back or the resources, or they are worried about the long queues that they're going to find at the hospital. So if they feel they are okay, which is not necessarily right, because what you feel may actually not reflect what your body is, they usually don't like to come back. And majority of the time, that's why you find that they even end up conceiving very fast because they didn't get this family planning advice that may have been offered to them if they had come to the hospital for review.
Let's dive in a little deeper into something that you just mentioned here, because now I'm curious about how would you describe the level of awareness and support that goes to new mothers, especially in the major hospitals in the outskirts, or what you refer to as the government hospitals. You spoke about human resource, but now I'm wondering about the level of awareness that some of the new mothers, as well as perhaps even the health professionals, how would you describe that?
Okay, I would say that the trend is improving. The amount of awareness and the amount of knowledge people, the level of awareness and the amount of knowledge people have regarding maternity and everything related to childbirth is improving. But there's still a lot of work to do. Even in the urban centers, there's still a lot of work and awareness to be done on our population. we are known for one of the countries having a lot of teenage pregnancies. Yeah, and you find that majority of the time these people don't have this information because they are teenagers. I mean, they've not learned from other people. Probably they've not gone to school well enough to have all this information. So the exposure to this information is less. And then there's the other side of medicine that is, I would say, local, the herbalists, and then the traditional healers that also have their version of practice that tends to convince people a little bit, and then they keep away from these other conventional medical care centers. So that affects the awareness a little bit. But when you look at the advancement of society, when you look at availability of social media, so the information is usually there, the people in the urban settings have become a little more aware. You can witness that when you interact them with in the sessions of antenatal, they really ask purposeful questions. So for me, I feel the people that are able to access premium health care really get the information, or they most times have the information. But like you know, majority of our people in this country are on a low social economic status, so they are not going to access these kind of centers. So they usually don't have the information. The information has to be given to them. Even when they have the information, they do not have a very clear interpretation of that information. So it has to be broken down for them to understand it. Because when somebody says puparium, and even here, I mean, in our hospitals, people are given return dates. Please come back and we discuss about this, and they never
They
come
don't
back.
come back.
Hey, you missed your appointment. Doctor was okay. I didn't find a reason to come. So the awareness has to be done. I think it has to start from the policymakers. They have to find a way of disseminating this information to people in a systematic way. Because if you run a campaign, for example, for 1 year, every other year there's another person who makes 18 and who is potentially a mother. So the information has to be continuous for people to be aware. But I would say in the urban settings, the awareness is a little more than the
In
rural
other
settings.
areas.
Yes.
But from your experience, do you think that, I guess, the health system prioritizes a little more on the antenatal and delivery care more than they do the postpartum?
I would. It's a bit tricky, this one.
Okay.
Yeah, but I would say that even in practice, when you are at medical school, one of the clinics that are less busy is the postpartum clinic, yeah, or the postnatal clinic. For the reasons that I've highlighted a bit, that majority of the mothers won't come back to the clinic because of those reasons. Probably it's far, probably I'm going to find a long queue. Maybe they're still dealing with the complications of delivery, yeah, and they feel, you know, they need to first handle that home before they come back to hospital. Maybe they're in pain. Maybe the baby got sick. So the attention given, especially the focus for me, I think, has to come from one, the policies, then to the hospitals, that they must emphasize. When we are discharging these mothers, sometimes you don't even tell them why they need to come back. Someone just say, okay, everything is okay, this is your medicine, look out for ABCD, and come back after 6 days, whichever date it is. Now, when I don't have a strong reason to come back, if I don't have an understanding of why I need to come back to see you, sometimes I take it for granted. And for me, it has to start there, to emphasize the reasons, touch into the complications that may happen from the time someone is discharged to when you want to see them. And then ask them to let them know that these are likely to happen. So where you're coming back for us to look out for this, and this may potentially take your life or the baby's life.
Let's hone in a little bit more and talk about a very specific area in postpartum care. Some women do experience excessive bleeding, perhaps even after. And I know that in some hospitals outside, women tend to have makeshifts, devices in order to basically take care of themselves, especially for vaginal care, whatever it is that they might need at this time. I know that some women would either rather cut off some cloths and rags in order to, or using cotton and overusing, and then the infections increase. Can you talk a little bit more in that area? What have you seen so far in the postpartum care, particularly in that area?
Well, in my practice, most people think I'm a little young, but I'm way older. So in my practice that spans over 20 years, I have practiced both in the rural setting and in the urban setting. And I've seen lots of things that you may describe as, I think horrific is on the other end, but yeah, they're really
Disturbing.
Really, exactly.
Yeah.
So I want to emphasize that you mentioned bleeding. It's one of the most feared complications of after giving birth or preperium. And it's the biggest cause of maternal mortality worldwide, let alone Uganda. Of course, in Uganda, it contributes up to about 42% of maternal deaths, just behind other things like infections, including malaria and so on. But rather just ahead of those. Yeah. So bleeding per se is something that has to be focused on if we are to reduce maternal mortality. And every mother, whether young or old, is at risk of postpartum bleeding or hemorrhage. The risk, of course, is higher in teenagers or young people. Reason is their awareness is little. And then, of course, there are other specific risk factors. Someone has given birth to so many babies, and maybe somebody who is carrying twins, somebody who has other bleeding disorders, and so on. Somebody who has had hypertensive disorders. The risk of bleeding is heavy. But back to your issue of, you wanted me to talk about infections,
Yes.
right? Yeah, so for a very long time, the practice in Uganda has been cotton and gauze. Yeah, as a means of people soaking the bleeding that happens after giving birth, and that's what I've known. And then there are also sections of people that use a piece of, cloth from anywhere, maybe part of their gomesi, an old son's t-shirt, and
I heard a story of someone using babies' diapers.
yeah, that's why I say that these things look horrific. The people have also had herbs wrapped into a piece of paper. Then there's a section of people that use tissue, yeah, the one that we use in the lavatories. So people use all sorts of things to hold on to, but that alone has kept the statistics for sepsis very high, extremely high, and these are very common things in public facilities, and also people that choose to use birth attendants at the village level. Yeah, they do not have access to clean sanitary wear that helps to prevent infection. So in the public settings, you're going to find they're using cotton and gauze, which they sterilize sometimes. But because the demand is way high, you may find that sometimes they don't even have time or the resources to sterilize every other cotton and gauze that we use on a mother. And that puts someone at a very, very high risk of infection.
Let's talk about those medical risks that women are facing when it comes to using perhaps unhygienic, unapproved, perhaps by doctors, materials for their postpartum recovery.
Well, I would say that when I was in medical school, we used to have what we call a mama kit. It's still available. I think it's available in the pharmacies for institutions that use them. And every mother during their antenatal would be asked, please buy and keep a mama kit to prepare for your delivery.
And that still includes the cotton and gauze?
Yes, yes. There's a roll of cotton and a roll of gauze. Now, I'll tell you, there are so many things that will happen. Someone will buy a mama kit, and where they keep them, you don't know. They have tried to, keep it in a polythene something, maybe to keep it away from moisture, from water, and maybe other bacteria. But that alone is non-sterile. Yeah, and then maybe a baby, the other baby is going to need something to use. The mother is going to pinch off that cotton and then clean this baby. Maybe someone will bleed, they'll pinch off that cotton. So it's not going to keep safe and sterile for that time when the mother has it at home. We don't know how you keep it. We don't know where you keep it.
We don't know how long you wear it for.
How long you wear it for. So then people are asked to make pads out of that combination. So you pinch a bit of the cotton, roll it out in a piece of gauze, so it holds it together, and then use it as a pad. So that is not clean, let alone being sterile for you to use. Now, whatever is on that cotton or gauze is going to be absorbed into your system through the vagina, and then it's going to give you serious infections. These infections, if I start talking about them, it's another day. But yes, these infections range from mild fevers, mild vaginal infections, to injuring your uterus, to damaging your tubes, putting you at risk of not being able to conceive again. So it's a whole range of complications, and the worst is death from sepsis.
Now, let's move a bit into the part of postpartum care. What should it actually look like? What is the ideal design, if I should say, of the recovery experience for women who are in postpartum recovery?
The standard should be look out for those complications. Prevent them if you can, manage them if they happen. That is standard care. And what do I have to do to look out for bleeding? One, have a designed, approved standard measure for knowing that this person is over bleeding, or the bleeding is within normal range. If you had your cotton and gauze that maybe will absorb 100 mils and get soaked, when I come and find it soaked, I'm going to think, oh, you're over bleeding. Yet actually it's the inability of whatever you're using. If you're using a silk cloth, and whatever comes out of your uterus and vagina is just flowing onto your bed, and you're going to be soaked in blood, oh, you're over bleeding, and then I'm going to panic. Yet what you're bleeding is actually normal, but it's not being absorbed in the right place. So the monitoring should have a standard way of assessing and making a diagnosis. If I'm using a standard and approved pad, I'll know that by the time this pad is soaked, it has absorbed this much of blood, and then this is not normal. If it is still okay, then I'm still within. So monitoring of bleeding is very key. Of course, there are other things that you're going to monitor on top of the bleeding. If this person has overbled, maybe their pulse is smaller, maybe their blood pressure will drop. So all those are part of the monitoring for bleeding. But also, the people who have picked up infections from poor perineal hygiene. And these infections show in the first 24 to 48 hours after giving birth. So monitoring someone's temperature is very important in informing us whether this person is picking up an infection or not. And engage the patient. Ask them how they feel. This is not very common in government practice or in rural settings. Mama asoti mwana ali bulungi, and they're not very free to express. I'm coming in with my white coat. I have over 50 patients to review, and then I have to do other things. Maybe I have to do theater. I have to do the antenatal clinic. I have a lot of work, and I'm not going to have enough time for every other mother there. But like you said, in nutshell, postpartum care is looking out for the complications, preventing them, and then managing them as soon as they happen, and then give as much information as possible to the mother regarding their health and the health of the baby, what complications or what symptoms they are likely to see or to experience for any complication that you expect them to have, and then give them timely reviews. We said it's a 6 rule, 6 hours, 6 days, and then 6 weeks. You must make contact with the mother within those periods. Yes.
Would you add into that perhaps using the right products in getting rid of some of the rags or not? Was that be a thing? I mean, I know it's a difficult thing to say right now, especially because of the status that we're in within Uganda. Would that be a thing? What do you think policymakers or stakeholders should actually do about it and do away with some of the old-fashioned way of postpartum care and leaning into more of the even newer, perhaps, products that are out there?
I'd say the government of Uganda has tried to, I feel it's not enough, but they've tried to move a step ahead. From the ordinarily isolated gauze and cotton they used to use, then the mother, the hamper, the pack. They try to conceal the gauze and cotton fair enough, but not really enough. But also I would commend them for allowing the private partnership, because maybe the capacity of our government has not been there yet to be able to provide all these essential, very nice standard care equipments to everyone in the country. But at least they've allowed the private section, the private sector to get in this standard. In Europe, people moved way earlier into different things, and some of the private entities have brought in these things. But I still think that they're still a little bit expensive for an ordinary person, but it's extremely essential. And earlier you talked about awareness, and I think it's key. Somebody is not going to be able to buy this hamper for, say, 150,000, but then they are going to shop for their baby for 1 million.
Yeah.
So where is the priority? I think the priority is somebody not having the information. This can potentially kill you if you use unclean stuff. It's going to give you an infection, give you lots of complications, including death. And then you're spending 1 million to buy a bodysuit that the baby is going to put on for 2-3 weeks, and then it's normal. So, like I said, the government has moved a step. It's not enough, but I think it's in the right direction to allow people to import in these quality standard things that mothers can use that have been available for a couple of years. And I would say that for the time that we have used them, and I know that also have other colleagues in other hospitals that they've used them, the rate of complications and infections have drastically gone down. Let alone the complications, there are other things, the comfort, what's the right word to use? When someone finds it easy to use, they would use it.
Convenience.
Yeah, exactly. It's convenience. The convenience to use these things, because if somebody is going to roll out gauze and cotton, you can imagine the degree of discomfort they're going to have. We encourage these mothers to ambulate or walk around immediately after, when in their recovery.
And now it's much easier to walk around.
Yes.
With them,
if you're going to use your roll of gauze and cotton, it's going to be bulk on you, and it's going to make you uncomfortable. You're not going to be comfortable walking around. With these other things, perfect.
Yeah. Dr. Nyombi, there are long-term consequences of using the wrong products during your postpartum recovery. Can you go into that a little bit and tell us what are some of those long-term challenges that women will end up facing, including postpartum depression, perhaps?
Yeah, you see, thank you. Very, very critical. When you, in practice or generally, the highest level of pain or discomfort that you get is the way your body is going to perceive pain going forward. Say, if your birth experience was extremely painful, it's going to take you way longer to recover from that pain. And psychologically, you're going to keep perceiving pain even when the body doesn't, that it's not in pain. So pain is very critical. It's a very critical component in our practice. Now, we both know that whether you're going to have a normal birth or a cesarean section, there may be a little bit of sewing. For majority of the mothers that give birth normally, they will either get a tear or an episiotomy, and this has to be repaired. If it's a C-section, then you have a C-section wound. So when you're using the wrong product, sanitary product, it's not going to facilitate healing. And that place down there has to be aerated. You have to use a product that is able to deliver oxygen right to the wound. Now, if you use something that's going to stuff and block off oxygen, it's going to keep the heat there, it's going to keep the blood there clogged, and then it's going to attract bacteria. Now, that alone is going to delay the healing process. And these stitches can be pretty painful. Majority of mothers will tell you that they even fear the stitches more than they fear the pushing. So you need to allow healing to happen as soon as possible for this person's pain to go away as soon as possible, because if the wound has not healed, it's going to be in pain. And I'm sure you've heard about mothers that say, I'll never go back to the labor suit. They are traumatized, not from the pain of the contraction or pushing, but even the stitches. So using the right product is extremely important, and these are some of the majority of the causes of postpartum depression come from here. When somebody gets a bad experience, they're stressed about something. They're stressed about their stitches not healing. They're stressed about picking up infections. So it keeps resounding in their mind. And you see the baby is crying. They are not producing enough milk because of the stress. And the baby cries, and they get fed up. And then that's how they throw themselves into postpartum depression. So using the right product is key to facilitating healing, whether you've had a normal birth or a cesarean section. The other aspect of using the right product is when you use the regular products that are not able to soak all the blood that you have to lose after giving birth, it's going to spill over and then come up to your wound.
Oh,
Yeah.
if you had a C-section, for
Yes,
instance.
if you had a C-section, for example, you're putting on a regular underwear and then your cotton and gauze. This cotton does not absorb well enough. I've seen cotton that looks like silk. Everything in Uganda comes. So cotton that actually looks like silk, or cotton that still has its seeds that wasn't well processed. You look at it, you feel it, and it has grains of cotton seeds in there. That cotton is not going to be able to absorb. What it does, when a mother lies down on their bed, this blood flows back up to the wound. So it doesn't give the wound proper hygiene, and it's going to delay healing. But one of the qualities of a good product is it should be able to let in air up to the skin of the mother, and that expedites healing, and it takes away the pain of the stitches. It gives the mother a good experience. Let the mother concentrate on the baby, not worrying about the pain of the stitches.
Or let alone worrying about the bed and the perhaps the, what do you call it, the bed sheets, and the family on the other hand, if they're not using the right products and there's a leakage in there, that could add even more to the stress.
Exactly, because now when they leak, and in our culture, once you give birth, everyone wants to come and see the baby, wants to come and see you. So there are people around you. You don't want to get out of bed because you're leaking. And then your growing an environment that allows bacteria to start growing and then pick up infection and that kind of thing. So the government should empower people. So many people should look at some of these products and maybe incorporate them into what they give to the general public to use. It's going to cut down their cost in managing infections, because once this infection comes in, you're going to manage it for a minimum of 10 days.
And less people into...
Yes, and then you're spending on antibiotics, you're reducing the productivity of people, but if you prevent it right from getting the right product, at the end of the day, you're cutting down on expenditure. Yes.
Let's go through that again. So the right product, let's talk to the women in particular, would be something that is aerated,
Yep.
that allows air to go through, something that doesn't clog
Yes.
the wound,
Absorbs.
that absorbs.
Yes. Absorbs without getting full easily, and then should be comfortable to put on.
And also, you mentioned about monitoring, because some of these products, you're able to tell, am I over bleeding?
Yes.
Or am I not
Yes.
over bleeding?
Yes.
Is that correct?
Now, for the right product, you can know that when I put on this pad, it can absorb a maximum of 100 mils, for example. Now, the moment it's soaked, you know that it has absorbed more than 100 mils, and that would be not nice. Not by, exposing the mother, open your legs and I see you, look there and see if there's active bleeding, or looking on the bed sheets to see if she's overflowing. By the time the bed sheets are actually wet, you're almost losing this person. So you should not wait to get to that point of, okay, let me see the bed sheets. You should be able to, actually, this saves on the human resource. Because once we equip the mother with this information that, I'm giving you this pad, we are going to use, you may use like 2 pads a day. If this pad gets soaked, please let me know. Then you don't have to frequently, keep checking on the mother, disturbing them, making them uncomfortable, because they know what they are supposed to do. If it's not the mother, then the attendant should know that I'm using this pad, this is how I'm supposed to look at it. If it's like this and it's over-soaked, then if it's like this, then it's within normal limits. Very easy.
Now, joining me is Lynn Matoni from More Distributors Uganda, a company that's redefining postpartum care through quality, affordable hygiene products designed to support mothers in their recovery journey. Now, from postpartum pads and liners to specialized care products for both women and men, More Distributors is helping close the gap between medical need and everyday accessibility. Lynn, welcome. Tell me a little more about More Distributors. What do you do and what products are you providing?
More Distributors is an East African company. It's a regional company. We deal in postpartum products, incontinence products, and with the regional distributors of these products from Europe. So we bridge the gap between the products in Europe and the products in the region, which I mean the East African region. So that is basically what we do.
In other words, the quality of your products is pretty high and the best?
Yes, very premium. So because they're from Europe, we expect the best. So a woman that is giving birth and using the products from Uganda is using the same products that a woman in Europe is using, actually. The same quality, same everything.
So we had an insightful conversation with Dr. Nyombi from Rosewell Hospital. Now, he touched a bit on the importance of using the right products when it came to postpartum care, such as using the right pads or the right having the right amount of absorption, being able to monitor the amount of bleeding if there is in postpartum care, and so many more other things he spoke about. He also touched a bit on the infections that could arise from using the wrong products or makeshift products that people make nowadays, where they're using just rags and cloths or sometimes even just the cotton and gauze. But I know that More Distributors has brought something that's game-changing for women out there. Can you share with me some of the products, some of the main things that women should be using the minute they get out of the hospital, out of delivery? What is it that they're supposed to be using? Take me through.
So when immediately the woman is given birth, whether it's a cesarean mom or it's a normal delivery mom, they can use this. So this is Fufsan Anatomic Super. There are 15 in a pack. and this is how the package looks like. So you can see there are 15 in a pack, and so the woman can use this immediately after giving birth. Why? Because of its anatomic shape. Anatomic is the shape of a human body.
Oh, so it covers every area.
Yes, whether you have a big bam bam,
Yes.
still yeah, it can cover up. So the woman is comfortable, her skin is dry, she's not irritated, it doesn't burn, and you know it has a very special layer called cellulose, and it is very, very absorbent. So there is zero staining of the bed sheets.
So in this
Zero
case,
staining.
women will not have to worry about using the cotton and the gauze because everything's already set and it's more comfortable, isn't it?
Yes, and actually we use that product, all these two products, they are used immediately after birth.
Okay.
So immediately after birth, women can use any of these two products, and they have to use it with a mesh panties. Now this acts as
Wow,
a
it's
knicker.
very stretchy.
Yeah. Yes, just like in your normal periods, you have a pad and you have a knicker. So this is the pad and this is the knicker. It is very stretchy, very elasticated, despite of the body size, the shape of the body. It is still very comfortable, it is breathable, it allows in aeration, hence actually faster healing of the incision. So the mom doesn't have to be
So
uncomfortable.
basically this acts like the actual gauze itself. Is that what you're saying?
Yes,
here?
even better. It doesn't act, it's actually
Better.
much more better, because this is improved. And where more distributors comes is to bridge that gap, is to shift, to lead the paradigm shift from using the cotton and gauze to using modern innovative products, postpartum products, which is lacking in hospitals. Because if hospitals that are now developing, they are basing on aesthetics, because women care about how is the hospital looking, how are the products looking, how are the services, the healthcare services, and that is where more distributors comes and says, if the health service is better, how about what we're using as women? And that's not normally talked about, the pads and all that. Yeah.
And that's quite important actually, not just for aesthetics, but genuinely in that there's comfort and convenience, especially I'm assuming when women go to to use the washroom for the first time, this would be much easier, isn't it?
And much better, because it also holds the stomach. You know, those days or long ago, or the traditional days, when we give birth, when our parents or grandparents were giving birth, after giving birth, they tie your stomach. So this helps to also hold the belly in shape immediately after giving birth. Yeah, so immediately after they get off from hospital, they can start to use this. This is the Fluffsan Lady Pants.
Oh,
It's
so
very
this-
stretchy. Now this is just a medium size. It is very, very stretchy, very absorbent. It is sterilized so that there are no infection. It's comfortable, it's breathable. So this is a pant pad. You don't have to put on with a knicker. It's a diaper. It's a pull off and a pull on another way. You just have to tear it off. Then when she's recovering, she can start to use this.
Oh, the smaller versions, but is
It's a
it still
smaller.
with the...
Yes, it's still with a mesh panty. Yeah, so that is a long line of more distributors. But we didn't forget about men, because men have issues, incontinence issues, and that's why we are engaging with urologists so that they can come in and giving the medical advice, the medical awareness of why men need to use these products. Not only the elder men, actually now it's starting with the younger men, the diabetes and all that, which is best explained by a professional urologist. So they can also use this for their incontinence. Incontinence, we can have urinary incontinences. They can use this as a diaper, because there's a problem in the market, Victoria. There's a problem of burning. The products that women are using, that men are using, they are burning, and that is why they have to introduce the cooling creams. So you find that someone has to put on a pad, but you have to put on a cooling cream, because some people have very sensitive skins and they'll have allergic reactions, not from the weather or anything, but because of the quality of the pad.
quality
And that's where we come in as more distributors.
Okay.
Yeah.
So how many more other products are there? It seems to be so many
Yeah.
and so different as well in size.
Yes, yes. Now we have an issue with heavy periods. We have, because you find that despite of a woman's location, whether she's in Moreto, she's in Kotide, she's in Gulu, she's in Kenya, she's in Tanzania, we have the same challenges and we tell the same story when it comes to heavy periods or postpartum bleeding. So that's why we introduced the Fluffsan Super Plus. It's a pad basically for those with very, very heavy periods. We have stories from different women in Victoria that are saying that they cut off the baby diapers. Women are cutting the baby diapers. Women are cutting mattresses. Women are using cotton clothes because they don't have an alternative. Not that they cannot afford, they are very, very affordable, but because they don't have the accessibility and the education, the awareness, the knowledge, and that's where we are involving so many partners so that we can get there.
I'm glad you spoke about partners. I believe that doctors approve of all of this,
Yes,
right?
yes,
They agree that women should be using some of these products, if not all of these products, if they're available to them. I guess some of the women would be asking about affordability. That's one of the major things that every other woman will ask. How affordable are some of these products? Are they easily accessible as well? Can somebody just call more distributors and say, hey, I need this and this? Or are the hospitals calling in more distributors and making sure that there's a huge supply for all the mothers in hospitals?
So on the issue of accessibility, we are working with so many partners. We are planning on to get more partners so that there is accessibility of this product, because the products are good, they are good quality, they're premium, and they have been recommended by Ministry of Health, because before we came to Uganda, we had 8 years of research with Ministry of Health, Ministry of Finance, and they gave us a go-ahead. The products are good. Despite the products being one of the best products in Europe, we had to do a research and a case study of our women, decide how are they feeling, what is their feeling, are they affordable, is it a better replacement of cotton and gauze? And then that's why we started working with Ministry of Health. So we are working with Ministry of Health, we are working with organizations like JMS, Joint Medical Stores, so that we can have accessibility for women in rural areas. They can be able to access these products at a lower cost. And that's why we are calling on other bodies, other parties, other partners, more hospitals where they are in a country or anywhere, so there can be accessibility, and the government can play a role to standardize these products, to standardize the prices, so that a normal grassroots woman in Karamoja, a normal grassroots woman in Gulu can be able to purchase this product and have the same feeling of a woman that has given birth at Roswell Specialist Hospital.
Absolutely. Let me say thank you to more distributors for all the work they're doing. And once again, Dr. Nyombi, thank you for sharing your expertise and helping us understand just how critical postpartum care is. Now, to every partner, policymaker, and even healthcare professionals watching, today's discussion is a reminder that postpartum recovery isn't just a medical issue. It's a matter of dignity, safety, and the value we place on mothers. And to all the mothers listening, you deserve the right care, the right information, and the right products to recover fully. I'm Victoria Sbia, and thank you for joining us for this important conversation. Stay informed, stay empowered, and take care.